Hello guys. Alright, I just did this whole thing for a video, and you know what? I forgot to turn my camera on. It happens. Okay, so this video is about post-traumatic stress disorder. I'm just going to get right into it. And this video will be divided up into two because this first part is for people older than 6, and then the other part is for people 6 and under. Okay. Post-traumatic stress disorder. Note the following criteria apply to adults, adolescents, and children older than 6 years. For children 6 years and younger, see corresponding criteria. A. Exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. 1. Directly experiencing the traumatic event or events. 2. Witnessing in person the event or events as it occurred to others. 3. Learning that the traumatic event or events occurred to a close family member or close friend. In cases of actual or threatened death of a family member or friend, the event or events must have been violent or accidental. 4. Experiencing repeated or extreme exposure to aversive details of the traumatic event or events. Example, first responders collecting human remains, police officers repeatedly exposed to details of child abuse. Note, criterion A4 does not apply to exposure through electronic media, television, movies, or pictures unless this exposure is work-related. B. Presence of one or more of the following intrusion symptoms associated with the traumatic event or events, beginning after the traumatic event or events occurred. 1. Recurrent, involuntary, and intrusive distressing memories of the traumatic event or events. Note, in children older than 6 years, repetitive play may occur in which themes or aspects of the traumatic event or events are expressed. 2. Recurrent distressing dreams in which the content and or effect of the dream are related to the traumatic event or events. Oh my god, you scared me. You scared me. Oh my god. My heart just like jumped out of my chest. Whew. Okay. Where was I? 2. Recurrent distressing dreams in which I think I just read that. Note, in children, there may be frightening dreams without recognizable content. 3. Dissociative reactions. Example, flashbacks in which the individual feels or acts as if the traumatic event or events were recurring. Such reactions may occur on a continuum, with the most extreme expression being a complete loss of awareness of present surroundings. Note, in children, trauma-specific reenactment may occur in play. 4. Intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resemble an aspect of the traumatic event or events. 5. Marked physiological reactions to internal or external cues that symbolize or resemble an aspect of the traumatic event or events. After I'm done reading this, I'll make you breakfast, okay? You want some bacon?
Maybe you can hang on and cook it. Or I can cook it.
I'll cook it, honey.
No, I want to try.
Okay, well, you can do it with me. Let me just finish this and we'll make breakfast together, okay?
I'll get set. I'll get the George Foreman and I'll get the bacon,
Okay, you can get it out and we'll cook it together.
Okay, I won't plug
Such a
it
big
in.
helper. That's good because it'll just turn right on. Okay.
There it is.
Awesome.
Awesome.
C. Persistent avoidance of stimuli associated with the traumatic event or events, beginning after the traumatic event or events occurred, as evidenced by one or both of the following. 1. Avoidance of or efforts to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event or events. 2. Avoidance of or effects to avoid external reminders, people, places, conversations, activities, objects, situations that arouse distressing memories, thoughts, or feelings about or closely associated with the traumatic event or events. D. Negative alterations in cognitions and mood associated with the traumatic event or events, beginning or worsening after the traumatic event or events occurred, as evidenced by 2 or more of the following. 1. Inability to remember an important aspect of the traumatic event or events, typically due to the dissociative amnesia and not to other factors such as head injury, alcohol, or drugs. What?
This is Charlotte right here. Right here.
Yeah, he's a little frisky right now, so be careful he doesn't scratch you. 2. Persistent and exaggerated negative beliefs or expectations about oneself, others, or the world. Example, I am bad, no one can be trusted, the world is completely dangerous, my whole nervous system is permanently ruined. 3. Persistent distorted cognitions about the cause or consequences of the traumatic event or events that lead the individual to blame himself, herself, or others. Persistent negative emotional state. Example, fear, horror, anger, guilt, or shame. I think I said 4. Okay, 5. Markedly diminished interest or participation in significant activities. 6. Feelings of detachment or estrangement from others. 7. Persistent inability to experience positive emotions. Example, inability to experience happiness, satisfaction, or loving feelings. I think he's hungry. E. Marked alterations in arousal and reactivity associated with the traumatic event or events, beginning or worsening after the traumatic event or events occurred, as evidenced by 2 or more of the following. 1. Irritability behavior and angry outbursts with little or no provocation, typically expressed as verbal or physical aggression toward people or objects. 2. Reckless or self-destructive behavior. 3. Hypervigilance. 4. Exaggerated startle response. 5. Problems with concentration. 6. Sleep disturbance. Example, difficulty falling or staying asleep or restless sleep. F. During the disturbance criteria B, C, D, and E is more than 1 month. G. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. H. The disturbance is not attributable to the physiological effects of a substance, example, medication, alcohol, or another medical condition. Specify whether, with dissociative symptoms, the individual's symptoms meet the criteria for post-traumatic stress disorder, and in addition, in response to the stressor, the individual experiences persistent or recurrent symptoms of either the following. 1. Depersonalization. Persistent or recurrent experiences of feeling detached from, and as if one were an outside observer of one's mental processes or body. Example, feeling as though one were in a dream, feeling a sense of unreality of self or body, or of time moving slowly. 2. Derealization. Persistent or recurrent experiences of unreality of surroundings. Example, the world around the individual is experienced as unreal, dreamlike, distant, or distorted. Note, to use this subtype, the dissociative symptoms must not be attributable to the physiological effects of a substance. Example, blackouts, behavior during alcohol intoxication, or another medical condition. Example, complex partial seizures. Specify if, with the late expression, if the full diagnostic criteria are not met until at least 6 months after the event, although the onset and expression of some symptoms may be immediate. Okay, so that is that one, and I will be back for the criteria for children 6 years and under.